Hi, my name is Kristen, and in this video, you will be learning about direct selection. First, I want to start by saying that when you have a patient who is unable to speak, you can use communication boards to communicate with them. Throughout this series of videos, you will learn how to use these communication boards with your patients. In this video, you are going to learn about direct selection. The definition of direct selection is directly using a part of the body or a tool to make a selection. So that is like using a finger, a button, or eyes to make a selection with a board. But in our case, we are going to be talking about our patients using their finger to communicate. Next, we are going to talk about how we know a patient is a candidate for direct selection. First, let's look at the referral chart, which is on the right-hand portion of this slide. Note that this referral chart is also as a handout in your communication cart. So, when you have a patient who is non-speaking, you will start with step 1, which is assessing their cognitive skills, language and literacy, and vision. If any of these are low, specifically cognitive skills and vision, this is when you can place a consult with CASC. Once we have assessed the patient, then we are going to move on to the right-hand portion of this chart under step number 2. Next, we are going to assess the patient's motor abilities, and this is especially important for direct selection. So we will assess their upper motor skills. In order to use direct selection, the patient must be able to reach out to their communication board and isolate a finger in order to select symbols. If the patient has these proficient upper motor skills and proficient cognition, then we would consider them as a candidate for direct selection. Next, I'm going to show you a video of what direct selection looks like, and then we will further discuss how you can use direct selection with your patients.
It's looking like you're a little uncomfortable. Is there something you want to show me? Okay. Oh, feelings. Let's find my feelings page for you. How are you feeling right now? Oh, pain. Does something hurt? Oh, something hurts. Okay. Let's go to our pain scale, and you can show me. Okay, do you want to show me on the body where something hurts? Oh, your ear. Is it both ears? Yeah, both ears hurt. Okay, so can you show me with the faces how much it hurts? This doesn't hurt at all, or it hurts a lot? Which one? Oh, okay, so it looks like your ears are really hurting you. Okay, let me check it out. Just 1 second.
Now that we've seen the video, we will talk about the steps to you becoming a successful communication partner. Step number 1 is to introduce the main communication page to the patient. This will be the first page of the communication book, and it is labeled on the back. Note that the patient may not be able to hold the book and point to the symbols by themselves, so you may have to hold the book for them so that they can point to the symbols. Next, you may have to explain the symbols to the patient. This part is really important because this is probably the first time the patient has ever seen these symbols before, so we don't expect them to know what these symbols mean right off the bat. Therefore, you may be in a teaching role and you may have to explain what the symbols are to the patient. So you can go through each symbol and tell them what it means, especially if they don't know how to read the caption at the bottom. Step number 2, the patient will point to a symbol on the main page, and then you will choose the appropriate communication page. These are all in the book and they are labeled on the back. A tip: when using these communication boards, since they don't speak, you should say out loud the symbol that the patient points to. So for example, if they point to body parts, you should say out loud, body parts. Also, when talking with kids, make sure that you use as short of sentences and as simple of language as possible. Step number 3, the patient will point to the desired symbol, and then you, as the communication partner, will voice the symbol and confirm their response. And last but not least, step number 4. You will respond accordingly to the symbol that the patient selects. If you have any questions, want more materials, or wish for a new board to be made, feel free to reach out to CASC and we are happy to help. The pager is number 0408. Thank you.